The novel coronavirus disease caused by SARS-CoV-2 is a major pandemic that has affected people worldwide, and deaths surpass 217,000 all over the world. The virus belongs to Coronaviridae family, having RNA as its genetic material, consists of three main structural proteins, namely the membrane protein, the envelope protein involved in virus assembly, and the spike protein which mediates the entry into the host. The virus can enter the body through eyes, nose, and the mouth. It then enters healthy cells through ACE2 receptors on the cell surface which are overexpressed in major organs such as lungs, heart, kidney, and the intestines, making these organs more prone to the viral attack. In majority of the infected cases, people recover from the flu-like symptoms, and in rare cases, the infection becomes severe that it affects the major organs. In this video, we will be looking at how COVID-19 affects different organs. When SARS-CoV-2 enters the lungs through the windpipe, it affects the lining of air sacs which are rich in ACE2 receptors. The host immune system attacks the virus, leading to the release of inflammatory molecules such as cytokines. Immune cells and fluid accumulates in the inflamed alveolus, ultimately reducing the oxygen uptake, thus resulting in breathing difficulty along with cough and fever. If disease progresses further, it causes the collapse of alveoli, leading to the condition called acute respiratory disease syndrome. In severe cases of SARS-CoV-2 infection, a condition called cytokine storm is observed, where large amount of inflammatory cytokines are released which cause more damage to body's own cells than to the virus itself. Severe tissue damage, blood clot formation, strokes, pulmonary embolism, multiple organ failure, and T-cell exhaustion are all caused as a result of this acute inflammation. Major cytokines associated with cytokine storm in COVID patients are IL-2, IL-6, IL-10, and TNF. Exact mechanism driving SARS-CoV-2 associated cytokine storm are currently unknown. However, IL-6 inhibitors are being used in clinical trials. Many patients infected with COVID-19 show heart-related problems, either completely due to the viral infection or as a complication of pre-existing cardiac disease. The virus enters cells, likely including those lining the blood vessels, by binding to ACE2 receptors on the cell surface while also causing damage to the myocardium. Infection can also promote blood clots, heart attacks, cardiac inflammation, and abnormalities on electrocardiograms. The patients also had elevated levels of cardiac troponin, a protein released in the blood by injured heart muscles. Therefore, particular attention should be given to the cardiovascular protection during treatment of COVID-19. Neurologists all over the world are finding evidence that COVID-19 can in fact affect and invade the human brain. Clinicians are coming across various cases of COVID-19 patients with neurological manifestations ranging from headaches to strokes, seizures, and even brain inflammation. Loss of smell called anosmia is also observed in many. Since ACE2 receptors are present in the neural cortex and the brainstem, the possibility of viral interaction with these receptors can be the reason for infection. But it's not known under what circumstances the virus penetrates the brain and interacts with these receptors. It is also found that patients with severe COVID-19 seems to have higher rates of liver dysfunction. An elevated expression of liver enzymes is observed which signals a struggling liver. Due to treatment with high doses of potentially hepatotoxic antivirals, antibiotics, and steroids, drug-induced liver injury in COVID-19 patients have been reported. Cytokine storm due to inflammation may also lead to liver failure in COVID-19 patients. SARS-CoV-2 may affect cholangiocytes, which are epithelial cells of the bile duct expressing ACE2 receptors. Kidney tubule cells also overexpress ACE2 receptors, making it vulnerable to viral infection. Studies show that renal impairment is common in COVID-19 patients due to elevated levels of plasma creatinine and urea nitrogen. Cytokine storm leads to intrarenal inflammation. In some cases, alveolar damage also results in impaired kidney function. People with compromised immune system is at higher risk. Those undergoing dialysis have weaker immune system, and people with a kidney transplant need to take anti-rejection medicines. These medicines work by keeping the immune system less active, thus making it harder to fight against the infection. The SARS-CoV-2 RNA was detected in the stool of patients. Reports and biopsy data suggest that the virus can infect the lower gastrointestinal tract, which is rich in ACE2 receptors. 20% or more of the patients have diarrhea, vomiting, and abdominal pain. Degeneration, necrosis, and shedding of the gastrointestinal mucosa of varying degrees were found histologically in severe cases of COVID-19. Patients with inflammatory bowel disease could be considered at higher risk for COVID-19 if they are being treated with immunosuppressive agents. The human conjunctival epithelium can easily be contaminated by infectious droplets and body fluids. Other routes of infection may include the migration of upper respiratory tract infection or the infection of lacrimal gland. Main symptoms associated with COVID-19 conjunctivitis are pink eyes, teary eyes, and eye irritation. Though not very common, the infectious spread through eyes cannot be ignored. Even when we all are deeply concerned by the alarming rates of spread and severity of the outbreak, it is absolutely necessary to take all measures to contain it. In addition to everyday steps, social distancing is one of the best ways to avoid being exposed to the virus, thus slowing its spread locally, across the nation, and worldwide. Butterfly Cancer Care Foundation thanks each and every heart that works towards keeping the world a safer place.